When a child gets the flu, they're more likely to give it to adults and others who cannot handle the influenza. While we actually had across the United States more deaths in children due to the flu than we've ever recorded before, it's still measured in the hundreds. But in the adults and in the older people, the rates of death are much higher. The rates of hospitalization, of critical care admissions are much higher. And it's always children who start the local outbreaks. So vaccinating children has always been critical to preventing flu spreading in the community. They're similar in that both can present with a fever and with a cough. Um, and they're different in that the flu, as a rule, tends to show up a day or two after you've been exposed, whereas COVID-19 can actually show up 2 to 14 days after you were exposed. Um, the flu can be hard on a person. It can cause complications. It can even cause death, but we're seeing much higher rates of severe disease, much higher rates of hospitalization, much higher rates of death with COVID-19 than we are seeing with the flu. Furthermore, while the flu does spread by contagion, we're actually seeing the COVID-19 spread faster and infect more people when exposed. And so there are some big differences between COVID-19 and the flu. They do behave differently, though they may present similarly and result in the need for testing. In fact, Mayo Clinic right now is developing a test that it can use that will test for both COVID-19 and flu simultaneously. Every one of us should be getting the flu vaccine every year, and this year it's more important than ever. Um, the vaccine is needed, the vaccine is safe, the vaccine's effective, and we really don't have alternatives to vaccine.